2 weeks in a row of blockbuster Monday morning pandemic announcements are raising hopes that the end of all this might really be within reach. This morning we learned Moderna has become the second company with a vaccine proving itself to be more than 90% effective in preventing COVID-19 infections. The Moderna vaccine, in fact, is 94.5% effective, according to the independent panel monitoring their early data, meaning vaccinations for the highest risk groups could start by the end of the year. Like Pfizer's vaccine, Moderna's would require 2 doses given several weeks apart. But one big advantage Moderna has over Pfizer is that its vaccine does not need to be kept nearly as cold and can stay refrigerated 6 times longer, up to 30 days. But although celebration is certainly warranted, we're far from out of the woods just yet. There are plenty of questions remaining about the logistics of getting vaccines to everyone, not to mention how long protection might last. And there's still many months to go until we see widespread vaccination. As a reminder, we passed the 11 million COVID case mark nationwide yesterday. And while it took us more than 3 months to see the first million confirmed cases, it took us less than a week to see the latest million. Here in Massachusetts, we're averaging more than 2,400 new cases a day. Some are predicting we're on a path towards seeing over 10,000 cases a day in the near future as people around the state are increasingly engaging in riskier behaviors. I'm joined now by one man who's raising those alarms, David Lazer. He's a Northeastern University professor and researcher with the COVID-19 Consortium for understanding the public's policy preferences across states. Dr. Katherine Gergen Barnett is the Vice Chair of Primary Care Innovation and Transformation and Program Director of the Department of Family Medicine at Boston Medical Center. Good to see you both. Thanks for joining me.
Thank you for having us.
David, can I start with you? You identified behaviors or activities that have been on the rise at the exact same time that infection numbers have been on the rise. You compared April with October. Could you describe a few of those behaviors, if you would?
Sure. We asked people about how much they were in rooms with other people outside of their household, because that's a setting where disease might spread, going to restaurants, going to gyms, being in groups more generally. And we saw all of those numbers go up 50%, 100% from what they were early in the spring. Of course, in the spring, we were all shell-shocked by how awful it was in Massachusetts. But it has gone up dramatically, and as our behaviors have changed, so have the case rates.
If we can just put those numbers up on the screen, have you been to a restaurant, 3-fold increase, seen someone indoors outside your household, doubled, and been to the gym from less than 1% to 7%? There's one piece, I guess, of good news. Mask wearing is on the increase in Massachusetts. Is that correct?
That's right. Massachusetts actually was very early on relative to the rest of the country in terms of wearing masks. And we have among the highest reported levels of mask compliance in the country.
So about a week ago, the governor announced some tightening of restrictions, curfews, earlier restaurant closings, smaller indoor gatherings. Based upon your research, did the governor go far enough?
Well, I think, the question one has to have is whether it really curbs the core behaviors that are driving the increase. If you have curfews for restaurants, if the same number of people go to the restaurant in fewer hours, that will make things worse. Mask wearing mandate is great, but actually mask wearing is pretty good in Massachusetts. And the one place that you can't really enforce mask wearing is indoors, where it's most important. So I'm worried that we're not hitting the brakes hard enough right now.
So what brakes should he be hitting that he's not hitting, David?
All I can say is, looking at the data is that we need to do more to prevent people from gathering in spaces together, right? That's the key thing that's driving the spread of the disease. It's not for me necessarily to say exactly what are the interventions to do that, but I feel like I think more, unfortunately, has to be done.
So let's see if the doctor feels it's her business to talk about more interventions. Should the governor be doing more? And if so, what?
Look, I totally agree with David, and I really appreciate the research and literature that you're showing in terms of social behaviors are changing. We're seeing it outside. We're seeing it in restaurants. We're seeing it in gyms. And the fact is everyone is very cognizant that governors don't want to go back down to a lockdown. We obviously know that's not what we want to happen in the country. We've heard that from Biden's transition team. But we have to be really thoughtful about, what's the bulldozer approach versus what's the sort of scalpel approach.
What is the scalpel approach?
Yeah, what is the scalpel approach? So, look, I think the is we know that things like perhaps curfews may not be enough. The fact is that people may be going inside to then gather in private homes, and that's when our case rate is going to be driven up, similar to what we saw David's literature showing in terms of social behaviors and people being more likely to gather inside. We also know that we don't want a breakdown and a shutdown of our economy. And I think that Biden's transition team is being really clear about wanting to avoid that. I think we, as our governor, is being really clear. But the fact is if we don't have a stimulus plan, we can't shut down. So we need to think about a middle road in terms of what are the most unsafe behaviors. And we know that gathering inside and eating inside, as David suggested, are among the most unsafe. And frankly, that's when we have our masks off and our guard down.
Okay, that means Zoom Thanksgiving, I think it means, to stay safe. Can we talk, leave the tunnel and go to the light for a couple of seconds,
Yeah.
Doctor? I know there hasn't been all of the review that there would be. This is a press release. There's been some review. Are you as confident about the results out of Moderna as even Anthony Fauci appears to be?
Yeah, look, I agree. There is such light at the end of the tunnel. I think I'm very optimistic. I joined the leagues of optimism on some of the recent results that have come out from Pfizer last week and Moderna today. We do not expect vaccine to have such high efficacy rates. We usually expect, anywhere from 50 to 70% is hopeful, and the fact that we're looking at 90 to 95% is very hopeful. That being said, there's a difference between efficacy and effectiveness. So what we're seeing now is in a trial. It's young, healthy people. We don't know how this vaccine will work once it gets out into the general population, once it works on people with lots of other chronic conditions. I know that both Pfizer and Moderna have done a good job in recruiting a pretty diverse group of individuals, but I think there's still a lot to be seen.
I want to ask you both, starting with you, David, if I can. I know neither of you are shrinks, but when I woke up this morning and I heard this news, my immediate reaction, speaking for myself, was it's going to be a lot easier for me to get through a Thanksgiving, for example, without our kids here, knowing that in the not too distant future, there will be a vaccine. A number of people I spoke to today, including on the radio, had the exact opposite concern, that we would begin to act irresponsibly because we see this proverbial light. What do you think about that, David Lazer?
Well, I think it highlights all the more reason why we should act aggressively now, because there really is a light at the end of the tunnel. Who wants to be the last person to be infected with COVID-19?
Yeah.
How we're going to react, it's hard to say. I think that I'm hoping that people will be hearing about the increases in cases and increases in risks, and be more careful and have less family or not have family over for Thanksgiving and so on, because otherwise these holidays could act as a real accelerant for the disease.
Dr. Gergen Barnett, you see patients, and I know that I'm sure you see it because I see it. There is pandemic fatigue. It's an overused expression. But do you worry about an irresponsible reaction to 2 Mondays in a row of good vaccine news?
Yes and no. I think, a lot of people may have shared your sense of, I can get through this and perhaps I can actually kind of buckle down and do my part, and maybe it won't be so important for me to go to that extra party if I know that in a couple of months high-risk folks can start getting the vaccine. Atul Gawande, I thought, used a really nice analogy last week in a conversation where he really said, we now have light at the end of the tunnel. Let's see how we can get everybody through that tunnel safely to get to that place. And I think the more we can communicate that, and simultaneously, the more we're working on really, making sure that people are trusting the vaccine. And creating conversations around that, especially, I work at Boston Medical Center. I think there's a lot of work we need to be doing in communities around trusting vaccines. And I think that's the work we need to do alongside this good news so that we can truly get to the good news.
Well, we only have a minute left, but since you brought that up, let me put something up. A survey from Stat News of the Globe and the Harris poll. The U.S. population as a whole from mid-August to mid-October, people planning to get the vaccine as soon as it's available, down 10 points. White Americans down 10 points. Black Americans down 20 points. Very quickly, starting with you, Doctor, what turns that around? I mean, a lot of people hope a president who is not homicidal in his reaction to the virus is a good first step. What is the solution? Quickly.
Well, I agree that is a good first step. I think we need to have leaders in the community who are from the community, really showing leadership around it. There's a great picture of Elvis Presley getting the polio vaccine, and that really turned it around for the polio vaccine. So how do we get leaders from each community kind of showing that they trust it and sharing their stories?
David, you study behaviors. How do we change that behavior quickly, if you can?
Sure. We've been also surveying the willingness to take vaccines. We've also observed a downward motion. I agree with the recommendation that we get people embedded in the communities who are trusted. You have to trust when the institutions, when you're going to be injected with something, right? And I think part of the reason why we see low levels of trust among African Americans is because of both contemporary and historical issues there. And then the other group that's very skeptical are conservative Americans. Trump supporters are actually very skeptical, even though Trump has been touting the vaccine as something that will save us. So our partisan breakdowns, our partisan polarization is also a big obstacle.
David Lazer, thanks so much. Dr. Katherine Gergen Barnett, to you as well. Appreciate your time.
Thank you so much.